Hello everyone, this is my new video in which we will discuss more detail about absorption. Okay, and after discussing about absorption, we will discuss about distribution, then metabolism, and then excretion. If you have any query, you can ask me in a comment box. I will reply at earliest. Thanks for watching my video and please show your support. Thank you so much. Now we will start about detailed study about absorption. So, in absorption, there are so many factors are involved. So here we will discuss about how the absorption we can increase and how the absorption one can decrease. So if the blood flow is good in absorption, then it will help the absorption process. Okay, means if the blood flow is increases, absorption is increases, absorption of the drug is increases, and vice versa. Here we will see what is happening. Increase blood flow to an absorption site, improve the drug absorption. Means where the absorption site, if at that site blood flow is good, then drug absorption is good. Simple, very simple, no confusion. Whereas reduce the blood flow, decrease the absorption. So simple. More rapid absorption leads to quicker onset of drug action. Okay, so what is happening? More rapid absorption, it leads to the quicker onset of drug action, because if absorption is fast, definitely it will lead to the quicker onset of drug action. Okay, for example, if we will see the example, the muscles area selected for intramuscular administration can make a difference in the drug absorption rate. Okay, so simple. This all points conclude to one simple thing, that if a blood flow at the absorption site is good, then absorption will be good, and if absorption will be good, it leads to the quicker onset of drug action. Okay, now slow by the pain and stress. Okay, how it's slow by the pain and stress? Pain and stress can decrease the amount of drug absorbed. How? Let's see. This may be due to the change in a blood flow. Okay, because if at the site of pain and stress, if there is a less blood flow, then absorption will affect it. Absorption automatically reduced, and reduce the movement through the gastrointestinal tract or gastric retention triggered by the autonomic nervous system response to the pain. Okay, it's very important. Okay, just keep this point in your mind, because it's very important and very easy as well. If you have any question, please ask. I'll explain you in more detail. Okay, high fat doesn't help. High fat meals, solid food slow the rate at which content leaves the stomach and enter the intestine, delaying the intestinal absorption of the drug. What is happening here? If any patient is having so much high fat meals, solid foods, then what is happening? So it will slow the rate of absorption, and because at which content leaves the stomach, okay, and enter the intestine slowly, the process will become slow and delaying the intestinal absorption of the drug. Simple. Doses of the drug. Yes, it's very important. Drug is administered in which doses form? It directly or indirectly linked to the you can say our absorption process. Okay, drug formulation such as tablet, capsules, liquids, sustained release formulation, inactive ingredients, and coating affects the drug absorption rate and the time needed to reach the peak blood concentration. Okay, yes, we all know that formulation, like in which form we are taking the drug, it always affect the drug absorption rate, and it also affect the time needed to reach the peak blood concentration level. Okay, absorption increases or decreases. Combining one drug with another drug or with the food can cause the interaction that increases or decreases the drug absorption depending on the substance involved. Means what we are eating, if we are eating some drug, with another drug, if you are eating some food with a drug, this all causes an interaction, and this, because of this interaction, either the drug absorption can increase or either it can be decreased depending upon what we are eating. Okay, so this is also very important. It's very simple points. I'm explaining in a very simple way so that you guys can understand very easily. Now we will move towards the next topic, that is the distribution. Okay, so our next topic is distribution. That is also very, very important one. Okay, so here after the absorption, it comes to the distribution. So what is happening in distribution? Let's see. Drug distribution is the process by which the drug is delivered from the systemic circulation to the body, tissue and fluid. So what is happening in distribution process? The drug is delivered from the systemic circulation to the body tissue. Distribution of an absorbed drug within the body depend on the several factor. It also depend upon the several factor, like blood flow, means how the blood flow, okay, solubility, okay, and protein binding.